Thank you so much for having me. My name is Executive Director of Feeding Indiana's Hungry. We are the State Association of Feeding America affiliate food banks here in Indiana. I have with me two of our members who are the real experts. I'm serving more as a moderator in this particular space. And so what we're going to do is I'm going to start through a little bit of background about who we are, what we do, and then talk about rural hunger particularly. And then I've got some questions for Julio and Glenn about how their food banks in particular address needs in rural areas somewhat differently than what they do in the other areas around our state. So I am going to hopefully share my screen. All right. So I'll start with, this is the map of our 11 members. We have 11 members in our state association that are all Feeding America affiliate food banks. That is a network of almost 200 food banks across the country. And the wonderful thing about our network is that every county in the country is served by at least one Feeding America food bank. Here in Indiana, we don't have any county overlap. We do have some state line overlap, which Glenn can speak to. But those are the 11 members that work with our association, and the directors of those food banks are comprised of my board. So we talk about the network. The food donations and food purchased at scale, along with USDA commodity foods, go through our 11-member food banks, many of those pounds will go out through programs through direct service from the food bank. And then a lot of it still goes out through 1,400 meal programs, food pantries, soup kitchens, all of those to the food insecure neighbors that we have around the state. So I mentioned there's just under 200 of those, and throughout the country, there are 60,000 food pantries and meal programs that the Feeding America Network works with. So describing what that network does. So the first thing that our folks do is secure food from local, regional, grocery stores, manufacturers, retailers, anyone that we can come up with, essentially within those service areas. So if you've been to a grocery store or a big box or smaller mom and pop stores or large growers in the area, our food banks work with the vast majority of those across the state to solicit and receive donated food, which is a taxable benefit to the entity that's donating it, working with our partners to try to find any excess food and get that to where it needs to go. Our folks have a vast shipping, storage, and distribution network. We are very much in the logistics business. So our food banks receive and safely store donated food and grocery products. We make sure that it's handled properly. Cold stays cold, warm stays warm, or room temperature stays room temperature, rather. We really don't do warm. And make sure that those are all held to the highest standards in food safety. And then the food is then distributed out either directly to clients or through those other services that serve in the local network. So last year alone, our folks distributed, actually this was a year before, 130 million meals. This last year it was about 100 million meals to the people in need. And as we're working with, not just providing food to those folks, the sort of the slogan is we want to feed the line but shorten the line. And so our members work with a number of programs around the state to help residents access programs that will help them, educating the public about hunger and what that looks like, advocate for ways to protect people from being hungry, and explaining really how the role of ending hunger applies across all lines, individuals, charities, businesses, and government. We are very much a public-private partnership in the work that we do. So one thing I want to make sure that I explain at least a little bit is the difference between a food bank and a food pantry. So a food bank, as our folks can tell you, is going to be moving and storing millions of pounds of food and working with those local food pantries that are situated already in the community by providing them food. All of our members provide some sort of mobile pantry where we take the food from the food bank directly to the community, as well as those direct service programs at the food bank. But there's a big difference. And so I deal with this a lot, and I think all of our members do. If you're thinking of this in terms of a scalable comparison, think, the Walmart distribution center to your Walmart, often on a smaller scale there. for the Walmart piece. But that's essentially what that network looks like. And so that enables us to work with 100 or 1,400 organizations throughout the state to help neighbors access food that they need. So rural hunger. This is the national snapshot from 2021. And I'd like to preface anything that we talk about during pandemic time, peak pandemic time. When we looked at the food insecurity numbers that we saw in 2020 and 2021, and even into we will soon start to see 2022 numbers. The data that we have shows that food insecurity was not significantly changed from prior to the pandemic. And that's definitely a great thing. We want for that to be the case. But the flip side of that is that it's also a reflection of the vast amount of resources that were being pumped into our economy and pumped into our food banks and our neighbors to be able to help them sustain that level of food security. So we know that when in 2021, a good chunk of Hoosiers were still receiving SNAP emergency allotments for at least part of the year. There were child tax credits coming. There was additional boosts of USDA commodity food coming. There were other pieces that were in place, enhanced eligibility for any number of programs coming through the federal government, through the state government. And so in that time period, we were thankful that food insecurity did not significantly change, but we recognize that that is a reflection of the response to the pandemic and the economic impact of that. So I wanted to preface that. So when we talk about rural hunger across the country, 11% of rural households were food insecure in 2021. So when we talk about rural counties, I think you know as well as we do, there's different definitions of how you define rural. So we use what the USDA uses. So that gives us sort of a count there as to what looks rural. And when we look across the country, granted this I think impacts more significantly in southern and western states, but 87% of counties with the highest food insecurity rate in the country are rural. So, this is something that we have been aware of for some time, right? When we look at the MAP, the Meal Gap report, you see that the food insecurity rate is highest in those rural areas. But we also know that people of color in rural areas are more likely to face hunger due to long-term inequalities. So when we look at, Black people in rural counties, non-Hispanic individuals, Native Americans, just like anywhere else you would see in the country, there is a disparate impact on communities of color as far as food insecurity and how that impacts them. And as you all know, there are challenges that come with living in a rural community that make things look slightly different than you would see in urban or suburban areas. So this is a snapshot, just to give you some idea. This is the MAP, the Meal Gap data that Feeding America provides on an annual basis. So this is the 2020 data that came out, 2021 that came out this year. And so this is actually an interactive map. I've got the website later on in the presentation, but to give you some idea, when we're looking at the counties with the higher food insecurity rates, most of those are rural. I will say the highest food insecurity rate is Scott County, which is rather rural, followed by Fayette. So what we're looking at in Indiana is this. By the way, the orange dots are where the food banks are located, just to explain what that looks like. So those are where our members are located. So we have experts with us here today, and because I can't toggle nearly enough tabs at the same time, I will have them introduce themselves rather than introduce them with their bios, but wanted to be sure to really plug the amazing work that these folks do. We have 11 food banks. They all have moved mountains over the last few years. I can tell you with great certainty the most rewarding thing that I get to do in my life is to talk about what these folks do and how they do it. So I'm going to stop sharing and come back. Okay, so we have Julio and Glenn. I'm to start from the beginning, and I'm gonna go order of my screen. So it's Julio and Glenn, and I'll switch it up later so that we're not besmirching southwestern Indiana. Julio, could you please tell me about your background and how you've come to the food bank, and tell me about your food bank?
Absolutely, and thank you for having us today. We always appreciate the opportunity to talk about what we do and to raise awareness of hunger in general. So appreciate being with all of you today. So I am Julio Alonso. I don't know who that young guy in that picture was with all that hair and everything, but I'm the real Julio. I'm the executive director and CEO at Hoosier Hills Food Bank. We are based here in Bloomington, in Monroe County, and we serve a 6-county service area, Brown, Lawrence, Orange, Owen, Martin, and Monroe counties. I've been at the food bank for about 17 and a half years now, and prior to that had mixed experience in the nonprofit arena and in government. Served as executive director of Community Kitchen of Monroe County for 4 years. That's one of our largest agencies here. And also worked on the other side of things as a congressional aide, as a director of public works for the city of Bloomington. So kind of a variety of public service experience coming into this. Our food bank is one of the smaller ones in the 200-member Feeding America network, actually. We distribute about 5.5 million pounds of food a year. Of course, that jumped to over 7 million pounds in 2020 during COVID. That's one of the things we'll talk about probably, that, that jump is something we just couldn't sustain without the continued support we had during the pandemic. But the fact that we've gone from 7 to 5.5 is not in any way a reflection of need. It's a reflection of capacity. So we work primarily with agencies. That's the largest part of what we do. We have a network of 100 partner agencies in those 6 counties, food pantries, kitchens, shelters, youth programs. And our job mainly is to supply those agencies with the food that they need for their programs. But as Emily mentioned, we also do some direct service programs as well. We have a mobile pantry that operates in 5 of our counties now. That was actually initiated in 2008 as a response to rural hunger and the fact that we identified several communities in our region where there weren't strong agency presences, and where we felt we needed to actually step in and go there with a mobile pantry of our own. And that effort has continued. We do a senior food box program through the USDA, and we have recently started what we're calling an equity mobile pantry, funded through a grant from Feeding America, that's intended to address some of the disparities that exist in access to food and to food insecurity, seeing higher rates with people of color and Native populations, and also thankfully, Feeding America has included rural communities in that continuum there. So we're able to use some of that funding and support to try and address the rural areas of our community. That's us in a nutshell. I'll let Glenn. Glenn does something that I would never want to do, and crosses state lines. So I have a lot of admiration for what he's able to do down there at Tri-State.
Okay, I guess I'll take it away. Thank you, Julio. And same thing, my picture needs to be updated. I got a little more gray hair than I did when that picture was taken. My background, golly, I've been in nonprofit world my entire career, but I was at a different end of the spectrum in my first career, and I was a classical musician, and I ended up managing symphony orchestras. So I've gone from feeding the soul with music to feeding bellies with food. I just love my position now because I'm helping people in need. That's something I always wanted to do. Our food banks, Julio's and my food bank, are really very similar. He's described, the core business of a food bank, and that's to supply pantries and soup kitchens and feeding programs with food. I'm constantly telling people the difference between a food pantry and a food bank. Some food pantries like to call themselves food banks, but I've given up that fight of trying to tell them you're using the wrong term. But yes, I have the joy of crossing state lines because we are tri-state, And we serve counties in Illinois and Kentucky. And our Indiana counties include Daviess, Du Bois, Gibson, Pike, Perry, Posey, Spencer, Vanderburgh, and Warwick. We're based in Evansville, which is in Vanderburgh County. But I would say of our service area, I mean, 95% in my book is rural. And so we are constantly doing so much in the rural communities. You know, one area that Julio touched on, he calls them mobile pantries. To give you some context, when I started with the food bank back in 2014, we had something that we called a mobile pantry that we did, and we were only doing maybe 10 of these a year, and it was just something that we did. If we had some extra donated product, we would put it on a truck, go to a parking lot, and put out these pallets of food for people to come. It was not a drive-through. People parked their cars somewhere. They walked up. We gave them a box or a bag, and they were able to pick from the pallets. And we'd say, you can have 3 cans of this or 2 cans of this, or mix this up however you want. But they were able to pick what they wanted. And so that was nice that they had a client choice model. But they took that bag or that box and went back to their car and drove away. And the idea of a mobile pantry, I found in the Feeding America network, was a huge growing trend going into the pandemic. And in fact, it was becoming very popular. It was popular with funders. They liked the idea. It was a discrete event. You're going to a direct community, putting food directly in people's hands. So they liked to fund it. And then you could give them the option of how many do they want to fund, because you'd have a price tag on these mobile food distributions or mobile pantries. And that we would say they cost $3,000. Do you want to do 1 for 3, 2 for 6, or 3 for 9, etc.? The pandemic changed everything. And as Julio and Emily said, that food banks received a lot of support and financial support, and we were able, as many other food banks, were able to acquire assets like trucks. And we do so much delivery, and we use our trucks so much, so now we could dedicate a truck or two to mobile food distributions. We switched from calling them mobile pantries to mobile food distributions, but the pandemic changed the model because there were some federal programs that came in and they provided semis of trucks, and they were going to rural communities, I mean semis, and coming in and doing these mobile food distributions with pre-packed boxes of food. And then as we all saw through the pandemic, people drove through. This wasn't they got out of their car, they drove through. We had to limit contact. And so they just opened their trunk, we put a box of food in there and said goodbye. That model, I think, is here to stay, the drive-through model, and there are pros and cons to it. The pro is it's very, very efficient. You have this pre-packed box and you go, here you go. We like to add produce or dairy if we can, if we have the funds to do that. So it's very quick and efficient. The con, in my view, is you've lost client choice. And you've lost a little bit of dignity in that you go, here's your box of food, goodbye. And there's not as much personal contact. When people go to a pantry or a soup kitchen, I think one of the biggest parts of hunger relief is the interaction they have with those volunteers, because they're not going there just for food. They need some compassion. They need people to care about them. And you get that when you go to a pantry or a soup kitchen. These volunteers are agency partners and the most wonderful people in the world. And then when you just go through a line with your car and have a box thrown in there and it's goodbye, I think you lose a lot. But still, it's here to stay. And as I mentioned before, in the early days, we would just use like extra donated product. Now the cost has gone up tremendously because we also purchase pre-packed boxes of food, and they're not cheap. So we have continued that model, and it's pretty expensive. And then we purchase produce usually if we don't have any surplus produce, and we purchase eggs and we purchase milk. Our mobile food distribution program now has grown to over 200. So it's grown from 10 in 2014 to over 200. And we partner with perhaps our own agencies. We'll have agencies in a rural community and we'll say, hey, when do you do your normal distribution? First Saturday of the month? Okay, how about we come 2 weeks later and do a mobile at your site? And so they become our host, or we'll find a school, or we'll find a church, or we'll find a business or another organization that just raises their hand and says, hey, can you come to our community? We now have one of our employees, their full-time job is to manage our mobile food distribution program, and it continues to grow. And fortunately, we do find funding for it. There's never enough. There's so much opportunity for us to do more mobile food distributions. One thing that I want to brag about that we stole from another Indiana food bank, from the food bank in Muncie, is a program that's specifically for veterans, and it's called Operation Full Pack. And I'm wanting to grow this program in all of our counties. We started it in Spencer County in 2021, and it's like a mobile, but it's a little bit different. Again, it's specifically for veterans. So we partner with American Legion posts, and we send food actually in bulk to them, and they pack the boxes, or they get a volunteer group to come in and pack the boxes. And so we have purchased all this food. We've got a great menu, a great variety of options, and they pack the boxes. They sign up the veterans. They put the boxes in the veterans' hands. So it's really like veterans helping veterans. And we're kind of behind the scenes, because veteran hunger is a little bit different than you see with other people, because there's a pride there. There's this military pride of not wanting to go to a pantry and be seen in line or whatever. It's gone over very, very well. And Spencer County is our county of highest need, and it is all rural. And we also do, as Julio mentioned with his food bank, we do a senior box program. It's a federal program. It's called the Community Supplemental Food Program, where we partner with all sorts of organizations where seniors who are income eligible get a box of food once a month. It's like a 30-pound box of food, and they get a block of cheese to go with it. It's a carryover from the government cheese program. That's your trivia of the day. But we're not able to do this federal program, this Community Supplemental Food Program, in all of our areas and all of our counties. So we have developed our own, we call it a senior grocery program. It's similar. We purchase the food, we bag it up, and but we'll also add some fresh produce on to that. At the very last minute, we'll buy some apples or bananas or potatoes, add the fresh produce, and that goes to senior centers. So where we can't do the federal program, this will fill in the gaps. Other programs that we do in general are like feeding kids. We've got a motto here at Tri-State Food Bank to try to sum up what we do as a food bank. And it's a short sentence. It's 7.5 words. We supply food where it's needed most. And to define where it's needed most, we say children, senior citizens, and those living in rural communities. And the rural hunger is a challenge. I mean, there are things that keep me up at night in general, and specifically in rural communities, because they face growing numbers of food deserts. Grocery stores are closing. The smaller grocery stores are closing. There's nothing to fill in. Some have to drive like 30, 35 miles just to get to the nearest Dollar General store to get some food. What keeps me up at night is shut-ins. Always thinking about that family or that senior citizen who doesn't have transportation to go to a nearby pantry, or even go to the mobile food distribution that we're doing. So these are the things that keep me up at night. We're trying to address them the best way we can. And but speaking of, I mentioned Dollar General stores, and to kind of pull this all together with Feeding America, our mothership, so to speak, who has these large national agreements and relationships with big companies. Dollar General, as you know, continues to grow, and they have become a huge partner with us. So what we can do as a Feeding America food bank is, through Feeding America, we can line up a Dollar General store to donate directly to one of our agencies. So if there is a Dollar General store in, Smithville, and we have an agency in Smithville, the Dollar General store will set aside food, and our agency will go straight to that Dollar General store and be able to pick up that food, which is so much more efficient than for us as Tri-State Food Bank to go all the way from Evansville to Smithville and pick up the food and bring it back to our warehouse. So that's an indirect way that by virtue of being a Feeding America food bank, that we can make these connections and get donated food efficiently to the pantries that are serving the rural citizens. So I've probably blabbed, more than my time limit, but I'm welcome to turn it back to you, Emily or Julia, or answer questions or whatever.
Yeah, thank you, Glenn. And I think maybe, let's see. I can't tell, I'm echoing somewhere. Yes, so you both really kind of delved into a lot of the things that we sort of had on the agenda, but I wanted to go back to something that you've both talked about in some regard. Anyone who is listening now or is listening later is, involved with the Rural Health Association. So they're well aware of what it looks like in their community. And odds are good, I hope, that they know the food bank that serves their community. You both touched on some of those novel ideas and some of those pain points. Are there any specific instances that you could share that something that worked really well that was sort of uncommon, or something that you still struggle with? Money aside, capacity aside, if you had all the money to do all you needed, Glenn, what would you look at in that space?
Well, what worked really well and continues to work is our relationship with the Purdue Extension. And it was during the pandemic that we worked with the Purdue Extension, and for them to identify specific communities and say, you need to send a mobile here, and to get our tentacles out. There's only so much I can do from Evansville. I can't cover 33 counties and make all the contacts. So working with the Purdue Extension was very, very beneficial. And also just listening to our agencies and networking with them, because they can point us to people and they can point us to funders often. And I would say, well, we're pretty pleased with how our senior grocery program is going. It's so efficient. And so you're hitting rural hunger and senior hunger at once with the senior grocery program. And well, I mentioned it before, the Operation Full Pack for veterans, that's a home run. And I'm wanting to expand that to all of our counties.
Excellent. Julia?
Sure. Well, one success, I guess, is also tied to the senior food box program. We the federal program provides a box of staple goods and that ever popular block of cheese, but doesn't provide anything fresh. So we have tried for quite a few years now to supplement that with some type of fresh produce as well, so that the seniors are getting access to that type of food as well. On the challenges side, I would say there are a couple of things. One, even these mobile pantries going into rural communities and stopping and setting up there, we generally partner with churches or with something like that to go in and set up for that one time a month distribution. They only serve people who can get to that location. They don't serve people in the outlying hills and hollers and the rural parts of the community. So that's a challenge. The other challenge is, again, we try to first bolster our partner agencies and get them the food that they need, because they're on the front lines there. Again, similar problems. People have to be able to get to those agencies. But the other thing that we're seeing is that many of those agencies, particularly in the rural areas, are almost completely, or if not completely, volunteer driven. And those volunteers are aging, and they're aging out. And new people in those rural communities are not stepping forward to take over the mantle. So we're seeing agencies drop by the wayside and seeing some of that ability to reach that rural community put in jeopardy. What is really needed is some way to get food delivered to these people where they are. Like I said, the mobile pantry is one way to do that, but really it has to be more individualized. And unfortunately, up until this point, we just don't have the resources to do that.
There's one thing that I wanted to throw out there. Oh, one quick thing that I wanted to throw out there, because I know that all of our member food banks have contracts to distribute the commodity foods. And with the Emergency Food Assistance Program, TFAP, there's the possibility of using proxies. So you're talking about folks who can't get there, but will one of you explain what the proxy system is and how that can help with folks who aren't able to get out?
If I can address that, because Julia and I are kindred spirits, and are, like I said, what keeps us up at night is hitting those pockets, the hills and the hollers. We've got something on the horizon that we are excited about. Now, we're going to launch this program in Illinois, one of those other states, just to the west of Indiana. But it is really a mobile pantry program that is a little bit different. It's not loading up a truck with boxes of food. This is truly a pantry experience on wheels. And this is a growing trend with food banks, and we use the St. Louis area food bank as a model, and theirs is going very well. They call theirs Food on the Move. I said, I love the name. Can I steal it? And so we're going to call ours Food on the Move. But what it is, we got a pickup truck hauling a 28-foot trailer, and it's able to go into some of those more difficult to reach smaller communities, and people will actually walk through the trailer, and it's like a little grocery store, and they have a volunteer with them. So now we bring back client choice, and so they don't get a pre-packed box of food. So it's a little grocery store experience. So we're hoping to launch that in the fall in Illinois, but I know I'm going to be bringing it to Indiana at some point. So, but on the subject of proxies, that is a big part of it, because you may be in the small community, but they're the shut-ins, and everyone knows each other in these smaller communities, and they'll say, hey, I can deliver, let me pick the groceries for Mrs. Smith, who is homebound. And using proxies is the way to get literal home delivery to these people who have no means of getting food.
And I would add too one thing, and my board has heard me say this often enough, I probably should just embroider it on a throw pillow, but if you've seen one food bank, you've seen one food bank. And quite frankly, if you saw one food bank before the pandemic, go back and see it again. Open invitation. All of our folks are looking for volunteers. All of our folks would love to see the public health and the rural health folks in their communities. So when we talk about a specific term, it may be different where you are. For instance, I think every food bank calls their mobile pantry something different. So it's pantry on the go, it's a farm wagon, it's a tailgate. If these terms sound familiar to you, you're from north of 40, and some of the folks south of 40 call it something different. So it's similar in concept. The general tenets are there. They may look slightly different. They may be termed something slightly different. So I would be sure to get that in there. So that is unique, and I'm excited to hear about that. What I would like to hear from both of you, if that's a food bank thing, is there a certain partnership in one of your rural areas with a certain partner that really sort of jumps out to you as a good model of something to be replicated? I know that many of our members are working with rural hospitals, are working with rural healthcare, schools in rural areas, community foundations. Those are fairly standard, I think. Glenn's nodding, so I'll take that as a yes. Those are fairly standard partners. What are some of the outside the box things that you have seen either you all do or you've seen within the network that would sort of look for a different kind of partner in a rural area?
Wow, wait, I have to take a breath to think about that, because I wish one was top of mind, that we've got some sort of newfangled type of partnership. I keep going back to the old-fashioned networking, and when you feel like you've hit a brick wall and you just keep talking to people. I'll use the Operation Full Pack as an example in that, and to find a partner with the church, because we have 2 American Legion posts where they said, you know, our folks are just a little bit too old, our backs are a little bit too worn out to pack the boxes. So we found, I just kept after it. I would ask a church and say, can you pack these boxes and deliver it to the American Legion posts? So is that some sort of innovative model? No, not really. That's just good old fashioned, you know, networking and keep, you know, hitting the bushes until you find someone who can help. And we have one agency where, again, it's finding that champion and who helps identify these small places where they know the people. They know the communities, and they say, you've got to go to this town, you've got to go to this town, you've got to go to this town. And that's just one of our agency partners who we just saw, well, there's a glimmer there. Can you help us? Maybe it's just about swallowing your pride and not thinking about, we're the food bank, we know, you know, how to tackle hunger relief. No, we got to rely on the people who are out on the front lines and engage them. So I wish I had that new model that everyone's going to, you know, want to get the PowerPoint on and replicate. But I think it's just good old networking with people who care.
Yeah, I would agree with that too. I don't have the silver bullet partnership. I wish I did. But one example I can give you is just building on the relationships we have with our partner agencies. And the best example for us is Girard Chapel in Spencer, Indiana, in Owen County, which has grown over the past 3 or 4 years to be our second or third largest agency out of 100. Really stepped up during the pandemic because of the leadership there, all volunteer leadership. But initially, you know, just a small food pantry who got what they could from us, come in here and pick up trucks and whatnot. We continue to work with them to try and build their capacity. They started being a CSFP outlet for us and actually letting us drop off the senior boxes there, and they handled the distribution point of it. They've raised money to build a new enclosed drive-through area where, you know, people can be sheltered from the elements as they're going through to get their food. They bought one of our trucks that we no longer had a use for. We were trying to, I mean, this thing was 30 years old, 250,000 miles. We did a campaign to replace it, and they wanted to buy it off of us, and they did. And they've used that truck to build their capacity to come here and get more food from us, so that we're able to load them up more. So, you know, just identifying those strong partnerships that you have already and agencies that have the capacity with a little bit of encouragement and help to build on what they're doing.
Excellent. So when we talk about the structure of food bank and food bank staff, all of our food banks have someone on staff who does some variation of what I'll call agency relations. May not be their only duty. They may wear several hats. You know, some places there are maybe more than one of those. And so folks who would be listening to this, for one, what would be your recommendation if they have neighbors who are looking for help beyond calling 211? You know, how do we connect with those agencies? And two, something that we hear a lot is, well, let's just put more food pantries in that community. Let's just, you know, we need more food pantries, but let's make sure that, you know, every little nonprofit in the community has a food pantry. That's not always the most practical way to handle things. And so it's kind of a twofold, like, how would you connect people who need access to resources, but how would you also encourage them not to reinvent the wheel?
A couple of thoughts on that, and because you've mentioned several times about connecting people to other resources. And, you know, especially we found during the pandemic, there were so many people lost their jobs, and it was the first time they were ever food insecure, and they didn't know where to go. And there was this thinking that, gosh, I'm not going to go to a food pantry because that's for the neediest of the needy. But actually, no, that's why it's there, is if you've hit hard times. But to direct them, especially to SNAP, because SNAP is actually the first line of defense in food security. I mean, for every meal that our Feeding America network provides, SNAP provides like 9 meals. So some people just don't know how to get enrolled in SNAP. So directing them to the resources that will get them that. Our mobile food distributions, we had a sponsor who provided Medicare insurance. And so they would show up at our mobiles and get people enrolled in Medicare. And a lot of people thought, I didn't know I qualified. And they said, yes, you qualify. I mean, that's money in the bank for them. And as long as we can find them some resource that's going to save them money or give them relief in another area, that's money that can go to their food budget, and they can go to the grocery store instead of having to go to the pantry. So it's about, like you mentioned earlier, Emily, about shortening the line and getting them more self-sufficient by directing them to these resources that are out there, but they just don't know how to access them.
Yeah, I would agree with all of that. I mean, I guess the one thing I would say is that there is, everybody wants the answer. What's going to solve rural hunger? And there isn't one, unfortunately. I mean, I think it has to be looked at case by case, community by community. There are some things that are universal, like Glenn talked about SNAP outreach. That's something we've got to do across the board to really get those people plugged in with benefits that they may be eligible for that they don't know about. But in some communities, more food pantries could be the answer, that, more of them spread out, and so that people have different options, because, we want to preserve dignity and choice as well. We don't necessarily want everyone to just go to one place, because that's the most cost-effective thing to do. So in some cases, that's the answer. In a lot of cases, it's trying to develop some sort of rural delivery system, whether it's house to house or small community to small community. I think you really have to look at each community and what the resources available there are and what the partners available there are, and how you tailor the response.
Oh, I've got Emily. I thought of one more, and this came from a rural community. One of our agencies that has a pantry. They enlarged and moved into a new pantry right across the street from their old one, and they took the old one and made it a shelter. And it was a place for people to be if they had to do an extended stay, and it was for the homeless. And so right in between, they built two, they're called tiny houses, the really small but efficient houses, and they are tiny. So if someone were to go into the homeless shelter and then get on their feet, they could move their family into the tiny house, and they could stay there for 6 months until they were able to save enough money to get an apartment or a house. So, I mean, that's taking them from here to here to here, all within their community, right there with the pantry and the homeless shelter and the tiny houses. I think that might be a neat model that can be replicated and show people how they can pull themselves out of poverty.
That is cool. What community is that in? What state is that in first?
Yeah, okay. It's in Illinois.
Okay.
Yeah, and it's in Saline County. It's in Harrisburg.
Okay. I had not heard of that. That's pretty cool.
Yeah.
All right, so I think we're going to move to the Q&A part. Carolyn, if there's folks on the call that have questions, if you can sort of queue those up. And I wanted to go back to share slides a little bit, just to show you all. or to re-show. Oop, wait, nope, not the audio tab. That is a weird function. So just as a reminder, this is if you are in certain parts of the state, this is who your point of contact is. So Julio is the light gold in the middle there at Hoosier Hills Food Bank. Glenn is the orange down at the bottom. But no matter where you are across the state, there's a food bank there that is serving your community. I hope if you're listening to this now or in recording, you're familiar with your food bank, but the websites are there, the points of contact can be found, and most of our members have a listing of agencies from their website, whether it is just a list or whether it is a searchable feature by zip code. And so that makes it easy if you are trying to help someone in your community, or if you are looking for places to volunteer, places to help out. As they mentioned, a large chunk of our network, not just at the pantry level, but also at the food bank level, is very volunteer driven. And so that's a really excellent place to plug in. So here are the pertinent websites. The information that I provided today came from Feeding America. Map.feedingamerica.org is the Map the Meal Gap, which is an interactive feature that goes, you can sort by populations a bit. There's some specialized populations, and you can sort by food insecurity. One of the interesting things to look at that particular website, and I'm not even going to try to show it to you in real time, but it tells you the populations that you're looking at and what percentage are eligible for those other programs like SNAP, like free and reduced lunch, that sort of thing. And so it gives you some notion as to what we're looking at, because what we have seen in these unique times is that there's a growing number of folks who are food insecure who are not particularly eligible for those programs, which makes it ever so much more important to ensure that the people who are eligible are connected to them. A lot of my job and a lot of what our association does is advocacy. A good place to plug in is feedingamericaaction.org, where you can go in and get national updates. Our website I'll have for you in just a minute, and we provide state and national updates on advocacy. And then I wanted to be sure to include Hoosier Hills Food Bank's website and Tri-State Food Bank's website. And then here's our website where you can find us. We are currently on Twitter and Facebook. We'll see how that works out. We're located in Indianapolis, and we're able to come at any time, or to speak at any time, to talk about what's going on in communities, connect you to your food banks, that sort of thing. You can find who our members are in that same map that you saw from our website. So I don't know if there were any questions or not. I wasn't able to see.
I haven't seen any come through yet.
Okay.
And I just want to let them know that if they do have any questions and they want to ask them live, they can raise their hand and I can open it up for them to talk.
Okay, perfect. Well, while folks are thinking, any closing statements, Glenn or Julio, what would your pitch be to those rural organizations, rural employers, rural services in your service area? What would be most helpful to you from them? Or how, maybe in the reverse, how could you be helpful to them?
Well, now that they know where we are, I'm hoping that they will reach out to us and if they have a creative idea, and just partner with us, even just getting to know us and come volunteer at our food bank or take a tour of our food bank. I say that to anyone. I say that to a legislator, anyone. Come take a tour of Hoosier Hills or Tri-State Food Bank or any of our food banks here in Indiana and learn what we do. People are always amazed when they come through our food bank. They said, I had no idea. I had no idea you did all of this. And on one hand, it reflects the great need that's out there, but on the other hand, it shows how much resources are going into this and how hard we're working and the different ways and the opportunities they can have to plug in. So again, it's just about connection, getting connected with the right people who are passionate, getting them talking, and then they can find out how they can work together.
Yeah, well said, Glenn. And we would appreciate that kind of outreach and contact as well. Always willing to do tours, to take volunteers, to have people reach out to us with ideas. I think one thing I'll just mention here is that I think one of the reasons this problem of food insecurity and hunger would be a lot more obvious and a lot more intense if not for this network. I mean, I said this at the start of the pandemic. The reason we avoided a huge hunger crisis in this state, in this community, is because we had this network in place that was ready to start receiving that food, taking those resources, coming up with programs on the fly, pivoting our programs, and was able to keep things going and expand. For us to go from 5 to 7 million pounds in 1 year is pretty extraordinary, and it was a heavy lift, but we did it because that infrastructure was in place. And so it's important to support us, food pantries, all of these organizations working on hunger on an ongoing basis, so that network is there to begin with if there's a crisis, but also the advocacy component that you touched on, Emily. Pay attention, call your legislators, write your legislators. When these things come up for funding, when the issues are out there, let people know that they're important and that there is a rural hunger problem and that it has connections to health. So yeah, just pay attention and advocate to the degree that you can too.
Great tee up, Julio. I was going to mention just briefly, you know, there's only a couple of federal authorizing bills that touch on nutrition programs. One is the Child Nutrition Reauthorization, which hasn't occurred in a while, but it only makes policy change. So long as funding is continued, that continues programs like summer food service, child and adult care food service, school meals, that sort of thing, WIC. But what's coming up this year is the Farm Bill, which is many titles around agriculture. You've got, you know, crop insurance, conservation, forestry, all of those things, but there's also a nutrition title. And what the Farm Bill does is provides authorization, policy change, and funding levels for really three primary big programs in our space. The Commodity Supplemental Program, which is the senior box program that both Julio and Glenn mentioned, which the reason that it's not everywhere is because there's a caseload provided to each state, and that gets divided up by counties. So it is not an entitlement program, it is a very limited program. The second program would be the Emergency Food Assistance Program, or TFAP, because we have acronyms for everything. And that's the commodity food. That's the old government cheese program, but it's everything. There's more than 120 options that are sort of on the menu, if you will, for what's available for states. In Indiana, our food banks have the contracts to distribute that, and that goes to every county in a certain formula based upon need. But the biggest is SNAP, the Supplemental Nutrition Assistance Program, the old food stamp program. You know, I don't remember who said it earlier, but for every one meal that a Feeding America affiliate food bank provides, SNAP provides 9. It is the ultimate and public-private partnership. It allows the most dignity possible in client choice because it's allowing for a household to go and shop the regular rails of commerce, choosing what they want, not just choosing between a can of green beans or a can of corn, but you get all of the varieties, fresh, frozen, canned, anything that is available that is not prepared food is allowable. So with SNAP, and this is a whole separate probably webinar and conversation, but with SNAP, you're able to buy food items that are not prepared. You cannot purchase alcohol, cigarettes, you cannot get cash. You also can't buy things like medicine, personal hygiene items, laundry detergent, things that households do need. But what's important about the program is that it provides supplemental access for a food budget to allow for other resources to provide for those things that it doesn't cover. This is something that is on the table right now. There are discussions that they would like to maybe see a farm bill by September and get one done within the course of the year. Please tune in at that Feeding America Action. You can tune in on our social sites. We have an advocacy email that can go out as well. This is really important, not just to our members from their ability to distribute food, but it's vitally important for our neighbors who are accessing that. There are roughly 600,000 Hoosiers who are currently utilizing the SNAP program. It's plugging millions of dollars every month into our local economies, in many rural areas. It is really a lifesaver for some of those rural retailers. And so it's an important piece in the advocacy space to help us to better alleviate hunger. With that, I think we have exhausted our time. Carolyn, unless you have any questions on tap.
We haven't had any come through, so apparently you guys went over everything great.
Excellent. Well, thank you so very much again for the opportunity on behalf of me, on behalf of Julio and Glenn, and the other 9 food banks that collectively serve our state. Again, our website is feedingindianashungry.org, where you can find and connect to all of the food banks in our network. Find the one that serves your counties, and we hope to see you in those rural communities, and we hope to connect with you.
Yes, well, thank you for presenting. It was a great information.
Thanks for the
Great
opportunity.
day.
Thank you. Thank you for the opportunity.